Is that okay if it's at that side?
Like here.
Okay. Right here.
It's little one there.
Okay, thank you. It says it's not available.
Also, I think, I'll have to use.
Hit the this no, come on.
Right next to the middle icon. There you go.
Why would
Just take it once.
I did?
Try again. There.
Oh, there.
Now you pressed it.
Oh, okay.
There.
Thank you.
Hi everyone. Can you hear me in the back there? Okay. So my name is Marco da Silva. I'm a veterinarian and professor in the College of Veterinary Medicine. I'm a professor of Theriogenology. What? Yeah. So what is this thing? So it comes from the Greek. So therio means beast, animal. Genesis is the creation or the generation, and ology the study. So basically, it's the study of animal reproduction. So I do work on multiple species, not only horses or our caseload there in the hospital. I would say we see about 1,200 cases a year in repro, and they are about 70% dogs, 25% horses, and then the other 5% food animal. I'm a member or a diplomat from the American College of Theriogenologists. That's the college that provides specialty boards for specialists. So how in the heck am I here, right? I'm originally from Brazil, which is a terrible place to be, as you can see. Not very beautiful places to go. Grew up in São Paulo city, which is a pretty large city, pretty much like New York. I wasn't a good fan of it. So on the weekends, we would go to the country side, and I would stay basically all day long around horses. And that's what, really brought my passion for veterinary medicine is through the horses. So in Brazil, the school system is different. You finish high school and then you take an entry test to go to a veterinary school. And so I wasn't the smartest one. So it took me 2.5 years to get into vet school. So you go straight from high school to vet school. The vet school is 5 years. So basically the first year and a half is a lot of the basic sciences, biology or physiology and so on. And then it moves on to more clinical aspects. The last year is full-time clinical rotations, similar to here in the US. That's the university I graduated from. It's called São Paulo State University. It's a public university in Brazil. You'll be surprised, but there are probably about 300 or 400 vet schools. And Brazil is the size of the US with a 230 million population. So it's really a business. The good schools, which are the research centers, are the public schools, both federal or state schools. So the one I went to is a state school. The other good thing about it is that they are totally free. So you don't pay a dime for school. Okay. The other ones are private schools. So basically you pay your diploma by monthly installments because the education they may get there is not, most of them are not top notch. The vet school was about 2.5 hours from São Paulo City in a place called Botucatu. Not a bad place to be too. This is a, especially if you go there, there was a bar here on top of this mountain. After you had a few beers, they would call this the laying giant. So you can see the head and the body of the giant laying down there. And of course, many hours out of class going on the waterfall. So Same thing you guys do here in undergrad. We were doing that in the first year of vet school, enjoying the city and so on. So during vet school, during my first year of vet school, because I was really a horse enthusiast, I got in and I applied for was a special program and so on. And they asked me in the interview, so what do you want to do? What's your preference? I said, I want to be like, well, I want to work with horses primarily. And I asked my colleagues, and there's a professor here called Marco Alvarenga, who works only with horses. So I got to go talk to him. That's him there. And he became my advisor. So we started a research project right in the first year of vet school. We applied for and got a grant. And the project was on diagnosing or choosing the best method to diagnose fungal endometritis. So endometritis is an infection of the uterus in mares that can be caused by fungus. So in this case here, you can see those long organisms are fungus, as well as the black arrows, the little dots are yeast. So we were quantifying how easy it was to visualize them and so on, both on cytology and the biopsy. So you can see on A, it's one stain of a biopsy, and the little black arrow is showing some yeast. So it's not that easy because we have a lot of red stuff. On the other hand, with the silver stain, the yeast stains black, so it's very easy to identify. So anyway, that got me going and interested in research. So that research was about a year, and then he went to Colorado for a postdoc, and I got another grant for another project that I don't have here with another professor in the same department, the reproduction, and we did that. So when I finished graduate school, I went to Colorado State University. So Marco Varenga was there doing his postdoc, and he invited me to come visit for 2 months. I went, and I was living in his apartment. He had a wife and a daughter, and I was sleeping in the couch. And after the 2 months, he was returning back to Brazil. So I was coming back too. And the professor from Colorado State said, why are you leaving? I said, well, because I don't have money. I don't have a place to stay. I'm staying in Marco's couch. And, I still need to finish a couple more rotations and graduate from vet school. So he said, what if I give you a stipend and you come live with me? I said, oh, okay. So I ended up staying there 5 months at Colorado State. In the equine reproduction lab. Again, it's not a bad place. A lot of stuff to do. That's me there, not Daniela. Don't lie. So this is the equine reproduction lab, and that's how it looks like in early spring. For a Brazilian that never seen snow, I'll tell you that I came in with a little overall from Dex that is like very thin, and I was running in short sleeve, and luckily my professor gave me one of hers, and it was insulated, and that was a lot better. As a graduate student, I did my master's and PhD there. I had very small budget for money. So this was my first car, even though you think it's yellow. Okay, let me warn you guys before I make this joke that I'm a reproduction guy, right? So talking about penis and this is normal for me, okay? So in the lab, this little Volvo, 1980 Volvo, yellow, but was named Golden Volva, okay? Because it was the equine reproduction lab. And it became so famous that even the cops like to take a picture of that. I was 339 or 25 miles an hour. And that old man over there, that's O.J. Ginter. He's a professor retired now, University of Wisconsin, one of the fathers of ultrasonography in veterinary medicine. He came to give a lecture and couldn't hold himself, but he wanted to go for a ride. Okay, so did my master's and PhD working with horses, assisted reproduction. Then took a job in 2006 as the assistant professor at Cornell University, Ithaca. Before that, in 2005, we were still in Colorado. And then suddenly Daniela came along. So she's a Coloradoan from 2005 model. And 2006, 2009, we stay in Ithaca, beautiful place, beautiful area, but a little too cold, too gray for Brazilian. So in 2009, we moved to Ohio State University and started here as assistant professor and so on. So that's basically, how I end up here. And I really like the College of Veterinary Medicine here. I think that we have an excellent dean. If you guys haven't met Dean Moore, any opportunity you have, try to meet him. He has done a tremendous work for our college. Has really stepped up on the support that we receive from the state, and we are able to, improve the college, improve the number of faculty, number of staff, and so on. So I'm very happy to be where I am. So that's what I have about me. Then I got, I think, like 3 clinical cases that we can go through. But I want to first stop here and see if you guys have any questions so far. Anything that you're curious or? Yes.
Why did you decide to go the reproductive route instead of other areas of medicine?
Yeah, that's a good question. So the reason is, like I said, I looked for a Varenga. He was a professor that only did equine. The medicine and surgery, large animals, they do both in Brazil. There's not equine surgery and food animal surgery. They do everything. So I really start working with him, and then you get to know people in the specialty, and then just evolve from there. I never, for once in my life, young life, thought that I would be in the US. So we in Brazil, when you go to school, middle school, high school, you get to have 1 hour of English per week. And I hate it. I hate it. Okay. I was like, how much do I need to pass? Okay, that's how much I need to get. But then, things just evolved, and I had to get caught up on my English because it was no good. It's still okay, but any more questions? Okay. I'll give another warning here. The clinical cases, there are some pictures and videos that people may, that people that are not used to being around animals too much, or maybe more sensitive, may not like it. So feel free to leave the room anytime. I'm not gonna get offended. Totally understand. But so let's start. Start with the first one. So this was I was still at Cornell, and this owner brought me a 5-year-old mini mare that had a history of dystocia. Does anybody know what dystocia means? What does it mean? Yeah,
Like
you're
problems giving birth.
That's right. Dystocia. This is difficult. Stocia is a parturition, so difficult parturition. So she had a difficult parturition that required a lot of pulling and manipulation and so forth. And that was about 6 or 8 months before she presented. The complaint was that, she is, every time she's going to pee, makes a lot of push, and some red membrane comes through the vulva and protrudes. So there's a vaginal prolapse, maybe. Okay, so then I want to examine the mare. Ignore that picture that I have a lot more hair than that picture now. You see, Daniela, I used to have hair. So this is how she would present. When she started to pee, she would really push and cause vaginal prolapse. So I went in per vagina and tried to feel what was that? Was that a piece of the vagina or not? And what I found is a complete hymen, if you will, had formed there. So a membrane had completely sealed that vaginal valve. And I was like, huh, that's not uncommon for mini mares after dystocia. If you don't treat appropriately, they will form adhesions. And then those adhesions can create a wall that prevents them from cleaning any fluid from the uterus. So my question then is, how thick is that membrane? Is there a piece of bladder involved or not, and so forth? So what I did is, so here is, let me make you position. So the head of the animal is this way. The body is, oh, hold on. Okay. So the head of the animal is on this side, butt is over here. That's, how can I point? Hold on. Let's wait. There we go. Okay. So this from here to here is the vagina that is completely distended with this echogenic fluid. Okay, so it's distended with fluid. And this down here is the bladder, the neck of the bladder, and the urethra going down here. So remember, I put my hand in the vagina, and then in the rectum, I put the ultrasound probe. And here you can see my hand or my fingers. Okay, that's my finger. And I can see that, okay, I just push in that membrane and there's nothing behind that membrane, right? It's a thin membrane. I should be able to just poke a hole and remove it. And that's what I did. So I stimulate the mare to urinate or to push. She pushed that membrane. And as soon as she did, I had a surgical knife. I made an incision and then wait until she stops straining, because you will see the little video. She will pass a lot of pure lead material. In fact, it was about 45 pounds or 45 liters. No, 45 pounds, which is about 100 liters of pus. She was very, very uncomfortable because of that distension. So let's see if this is going to work. Oops. Okay, so I think we're going to go with plan B here. Oh, it's beautiful.
Let me see if I can do this.
There we go. Okay. Are you ready? Nobody's eating, I hope. So
Let's see.
I lower it.
I don't know. Okay.
And that was one push, and then she had a lot more inside. So
Okay.
yeah, let's get back there now. Perfect.
There we go.
A little more.
Okay.
Yeah, perfect. Thank you. Okay, so what I did after she stops pushing, I went in, put my finger in the hole, and then we resect the whole hymen, if you will, that was there, making that open again. And then we were able to flush that uterus with saline and then infuse antibiotics and treat her with antibiotics for a few days before sending her home, and she did just fine. So mini mares and oops, what? Page up. It's not changing there.
Here, let me see.
How about if it was slideshow?
Yeah.
Resume slideshow.
Let's try. Still not.
Now again, you can change that.
Okay, I think it's frozen on the screen. Let's try this. That's good.
I got an idea. Let's see if you just close this. Okay.
Oh, there you go.
Now I just need to get back to where we were. Yeah, it doesn't like that. So, okay. Here and
Yeah.
3, 2, 1. There we go. So yeah. And that's Dr. Gilbert. He was a senior faculty there and he was helping me. Very generous of him. Okay. So questions about this case? Yes.
Did she have infection in her blood or anything?
No, she did not have a UTI or anything like that. In fact, that's even though it looks like pus, it's sterile.
Wow.
Because what happened is the uterus naturally produces fluid throughout the astral cycle, and that fluid comes out and is drained to the vagina and goes away. Because she had that hymen, it slowly accumulated in the uterus to the point that the uterus couldn't retaining anymore. The cervix opened up and everything was all the way to that hymen membrane. Yes.
Common after this death and many horses to like rebuild that hymen, how long would it take?
It can take about a couple of months. So what we do is usually when they have a dystocia, it depends on how much bruising it happens. You want to treat daily with the ointment that has some steroid cream. So this way that steroid prevents the adhesions from forming, as well as you going in mechanically, you start breaking up some of the adhesions that it's not trying to form. Questions? Okay, so now we're going to go through another one that is not as graphic. So this is a 9-year-old quarter horse stallion that presented to us for breeding sounds exam. Okay. And the history is that he wasn't producing a lot of sperm in terms of numbers, and he was a little reluctant to jump on mares. He could change mares and do whatever. So he was a shy breeder. They used to do live cover or live breeding. So we started with attempting a semen collection. And this is the setup that we used to have. Nowadays it's similar, but different. So you have a mare that is in heat. So we use that mare as a teaser. The stallion gets sexually aroused, and then we move the stallion into a phantom. The stallion needs to be trained for that, and then he jumps. And as he jumps, we use, it's hard to see here, it's basically a PVC pipe with hot water and a latex bladder that simulates, it's called the artificial vagina, and that stimulates the stallion enough so he ends up ejaculating into the vagina, and there's a bottle at the end, and you are able to collect the semen. So even though it's, you can think about being a little scary to be under a horse, a stallion like that. So, and it is, especially when he's not very smart, but this person is the most important person, and needs to be one that if you are collecting, you trust, and person knows what she's doing. Because you can see, I'm not even paying attention to the front of the stallion. I trust that she will push me out of the way or yell at me, get out of the way, he's doing something stupid. Okay. And the other very important thing, if you look about my feet, is away from the stallion, because I don't want to get stepped on by those hind feet that are holding the entire weight of that stallion. That will leave a significant bruise. So after we collected, we analyzed the semen. Just the first collection, collect twice within an hour, he gave about 16 billion sperm cells. And then an hour later, we expect that they will give about half of that. He only gave about 1 billion. So my thoughts on the second ejaculation is this is a partial ejaculation. He did not fully ejaculate it. Okay. So, but the quality of the semen wasn't too bad, except the numbers on the second one. Next, we did a ultrasound of the scrotum contents. Okay. So in the scrotum, even though you think, oh, of course, you have the testicles. Yeah, you have the testicles, but you also have the epididymis that is, so sperm is made in the testicle, runs into the epididymis to get matured. You also need, you need to have blood coming to the testes, right? And there's a pampiniform plexus, as you see in the next slide. Why is it not changing? Oh, okay. So here you can see these are the blood vessels that go into the testicle, and the curiosity here is the testicle needs to be a couple of degrees Celsius colder than the body temperature. Okay, so if not, the sperm that is going to be produced is going to be defective. And this is a very important mechanism of countercurrent. So the testicular arteries that are bringing the semen at body temperature, or bringing the blood at body temperature, really run close to the testicular veins that are bringing the colder blood up. And there's a heat exchange this way that maintains the temperature of the testicle below the body. The other thing is there's the musculature, the darkness muscle, the cremaster, that brings the testicle closer to the body or away from the body, depending on the outside temperature, right? So that thermal regulation, we call, is very important. But so far, everything looks pretty normal until we found this guy over there. Let's see if I can get at least the pointer. Yeah, so you can see clearly here that this is testicle, very homogeneous, very boring image. And suddenly you have this nodule or mass that shouldn't be there, okay? So we palpated, and it palpates like about an inch or an inch and a half nodule near that, well, adjacent or attached to the testicle. So we talked to the owner, and we told him that quite likely or possibly is a testicular tumor, okay, that he would need to be castrated. But the owner wanted to keep him as a stallion to breed mares. So we suggested to do a hemicastration. So meaning we're just gonna take the testicle that is affected by that tumor and leave the other one in there. Oh, so that means he only gonna breed half of the mares? No. What happens is when you do that, the remaining testicle undergo hypertrophy and produces more sperm. So the numbers within a few months comes back to almost the same as before. Okay. So after we took the testicle out, you can clearly see the mass that was here. We dissected that mass out. Here's another. Submitted to histopath, and the pathology said that is looked like a benign mesenchymal neoplasm that looks like smooth muscles. You guys had that histopath? No. Anyway, that looks like a smooth muscle, so it would be a leiomyoma, okay, in the tunica albuginea. Okay, so how common is that? Not very common. Leiomyomas are somewhat rare. There are only a few reports. The most common ones are interstitial cell or Leydig tumors, teratoma. Teratomas are cool. So that's one here. It's hard to see. But there's a teeth in the ovary or in the testicle, I'm sorry. The teratoma is a tumor that it forms from, think about stem cells, right? So it will make hair, will make teeth, will make everything in the middle of this mass of tumor. And it can happen in the testicle. So bottom line is leiomyomas are not very common. What's the prognosis for life? As I mentioned, it's a benign tumor. We took it, so it should be curative. Prognosis for fertility, again, compensatory enlargement of the other testicle, and he should be just fine, which indeed, he came back 6 months later and produced, you can see here, the first collection, 16 billion, which is exactly how much we got the first time, and the second collection, 14 billion, okay? So, and the quality was fine. Questions about this case? Yes.
So you said that likely we're getting the full ejaculation. So like, where does that go?
Good. So why we didn't get a second ejaculation? Why the owner was saying that he was a shy breeder, right? That he didn't feel very comfortable. We suspect that mass was putting pressure in the pampiniform plexus, which is those vessels, and there's a nerves that go through that, and that when he was in the middle of mounting a mare, that was probably not very comfortable, and he would back up. That was because after we castrate, he was breeding mares just fine. The owner reported. Any more questions? Okay, how are we doing on time? Doing good? Okay, we'll go for the last one. Okay. The last one has to deal with a dystocia, right? As we talked, that's difficult birth. So in veterinary medicine, we have terms to describe how the fetus is presenting during a parturition, okay? So the normal presentation, position, and posture is like this for a large guy, okay? With the head extended, the both upper legs extended into the birth canal. Okay, so usually you will see feet first and then the nostril coming right after. They can also come in a transverse presentation. That means it did not rotate or position itself correctly, right? So this guy cannot be born this way. That will be certainly a dystocia that will need manipulation to correct. We also have a correlation between the spine of the fetus and pelvis of the dam, so we call it dorsal. So if you look at the dorsal aspect of that calf, it's such the sacral area of the dam, so dorsal sacral. If that foal is upside down, like here, the dorsal area is doing the pubic bone there, so dorsal pubic, okay? Can foals be born backwards or calves? Yes, but not like this. They need to have dorsal sacral, so they need to flip that way. Okay? Because if you think about it, it needs to make a turn like this, and that the back is not going to turn and make a bend that far. So we're going to get stuck there. So in this case, you need to turn that foal around and then pull it out. And then also, the limbs and the neck can be malpositioned and needs to be corrected. So, for example, the two front legs there are bent in the carcass, so it's not going to fit in the birth canal. So you need to make sure you pull those legs straight. In this case, same thing here. You need to make sure that you correct that first before you can pull. Okay. So there are 3 rules for obstetric manipulation. Be clean, because it's not a sterile procedure. Be gentle, so you don't want to cause any damage to the mare or to the fetus. And use lots of lube. Lube is your best friend for any distortion in large and small animal, because once that process of parturition started, they have the water breaking, right? So most of the fetal fluids are draining out, lubricate that birth canal, things get stuck. Hours sometimes go by, gets dry, the hair against the mucosa dry, it's going to cause a lot of abrasion or bruising, and it's going to require a lot more pull or force to come out than not. So this is how we manipulate those cases that come in the middle of the night. Most animals that come for us, most mares that come for us, they come already from at least 2-hour drive. Foals only survive for about 30 to 45 minutes after they start labor. Okay. So when they come here, the foal is already dead. But we check. We ultrasound the mare as we get the mare ready for general anesthesia. We ultrasound and confirm that the foal is dead. If the foal is not dead, then the speed we move to the liver is a lot faster, because we need to get that foal out of there. Otherwise, we will suffocate and undergo hypoxia. So this technique here, what you are doing is lifting the hind legs on a hoist and pretty high. So basically the belly goes down here. Gravity is going to help. Okay. Remember those, for example, this guy here. There's not enough room because the uterus is pushing that the carpus is hitting the pelvis. There's not enough room. First thing I need to do is shuffle that calf back inside a little bit to create some space. That then I can go and grab that leg and straighten one and straighten the second one. Right? So that's why we put them under general anesthesia and elevate the hind quarters. But sometimes, even though you try your best, you just can't. You need more room. For example, with that head flex, sometimes you need to. It's much easier. The foal's dead, right? It's much easier. You have access to the neck. Why not cut that neck out? Okay, take the head out and then bring the rest of the foal, right? So there is it's called fetotomy, and we have the fetotome, which is a long metal instrument with our 2 channels. We use a giggly wire, which is a saw wire that runs into one hole. Then, for example, if I'm trying to get the neck, goes around the neck and then comes back in the other hole. And then we just cut the neck this way.
Using it on horns?
Yes, it's pretty much. But we use the phytotone, so we protect all the mucosa in the vagina and the cervix. So, for example, as I mentioned, this guy here, look at how far back this front leg is. And the head is already in the birth canal with the front leg. There's not enough room. And I'm going to struggle to be able to reach, at least to the carcass here, to be able to bring the leg forward. So the fault is that it will take me 3 minutes to do a cut. Like here, for example, right behind the neck. I cut it, take the head off. Now I have a lot more space. Then I go fix the leg and we extract the rest. Okay. So the case, and you can do that with basically any part of the body. This case is cutting right behind the scapula to pull the entire leg out. There's a technique to do those cuts. But why we are talking about this? Because now we're going to go into the case. A mare came in at term with dystocia. So we went in. I usually let the residents go in and try to figure out things first. And she was an excellent resident, but she was struggling to figure out what the hell is going on. Why is this head not coming in and not feeding the birth canal and so on? So after a while, I said, let me have a feel. And I could feel that putting the head here was pretty big. You know, I have a big head, but it's much bigger than that. And soft, okay, fluid feel, okay. So that is a condition that's called hydrocephalus, right? And this is how it looked like. This is after we pulled the foal, okay? So you can see that it's a much bigger dome of the head, and there was fluid in, so there was no way that was going to go through the birth canal. Okay, extra point here. Who knows what this thing is here? Who grew up around horses? Nobody? No, not meconium. No, go ahead. People joke as the full spilo. Basically, it's called hippomane. It looks like almost liver consistency. It's about this size, and it's just a concretion of hair and all cellular debris that accumulate at the bottom of the belly, and then it forms this thing that comes out of the foal. So if you're foaling a mare and you see that, don't freak out. So how did I get that big head out of the mare? Right? I have to do something because I cannot make the birth canal any larger, so I need to make the head smaller. So here you can see what I did. I cut the head from here to here. See that little cut? And with that, the fluid went away. This bone, it almost, I call it a handlebar. It almost looks like a basket that you're carrying over here. That thing came out, and then I was able to deliver the rest of the head with very, very much being very careful, because these was very, very sharp. So then going through the birth canal, you have to basically sacrifice your hand, because you put your hand between the mucosa and the bone and so on. And so just a couple more pictures. I was like 8 inches wide. So there was quite a bit of fluid in there. This is what the brain looked like, or looked like, okay? Very, very thin. Look at how thin that brain was, because undergo atrophy because of the pressure that the fluid accumulation caused. So that's common in any organ, As soon as you have a cyst, for example, in the kidney, commonly have a cyst and that cyst keep growing, it will basically cause atrophy of the good tissue around, and suddenly you end up with no kidney, just a big cyst. Okay, same thing here. So the good thing is that, yeah, that foal was lost, but the mare did very good. Went home in a couple of days, and was able to produce more foals throughout the her life. So this is it. Thank you. So, do you have any question, not necessarily related to presentation, about anything?
So do you know the underlying cause of why that happened to the foal? Was it genetic? Was it?
Yeah, it's a genetic condition, in particular in oh my goodness, the specific breed, Palomino color. Oh, gee, Heflingers. So in particular, the Heflingers, that was the breed of that mare. They have that genetic anomaly, and they have a higher incidence of that.
Is that partially because they're like a dwarf crop?
Good question, but it could be.
Yeah.
But they have actually a genetic test that you can run on your mare and your stallion to see if there is a chance of getting.
Do you know if they ran that test and it was a low chance and it happened anyway, or did they not?
They did not.
Yeah.
Questions about vet school or anything?
Actually, if I'm for someone who gives one of those.
Equine medicine, externship, because of course I think it's a great area to go in. The lifestyle it's changing because less and less people want a too large animal because of the lifestyle. Why am I gonna be driving around a truck for many miles and crazy hours versus working 4 days a week, 8 to 5, making the same money and so on, right? But I think because of that, now it's competitive as well. You have to, if I have a position open and I have one person that spent 2 weeks or a month with me and I like it, and the other person that looks great on paper but I never interact with, I'm gonna go with the other one that may have lower grades or whatever, but it's a person that I like to work with, as is willing to learn and so forth. So I think looking for externships, especially on places that you may consider working one day, it's very important. It should be. It starts day one, and that's